In 2014, a small village in Cambodia's Battambang province made headlines worldwide. A widespread HIV outbreak was caused by the use of contaminated needles by an unlicensed doctor. After this shocking incident, questions were raised about Cambodia's primary healthcare system. The Cambodian government responded by accelerating the improvement of people's living conditions to ensure better access to health services and vowed to eradicate unlicensed doctors from the country. In 2017, we travelled to Roka village in Battambang province. This quiet hamlet is known as the HIV village. When we arrive, we can see that the entrance to the village is a paved road in good condition compared to normal roads in rural parts of Cambodia. This is a tangible result of the government's efforts to solve the problem of people's inaccessibility to basic health services. The government had to step in because the villagers had no access to public services and had to rely on an unlicensed doctor, which led to many women, men, elderly, children and even monks becoming infected with HIV. Nowadays, Mom Heng has to take antiviral drugs regularly, prescribed by a real doctor. Pok Sujit serves as the chairman of the Buddhists for Development Organization Council, which is actively engaged in educating people about HIV, with a primary focus on preventing infections. Those who've not been infected will concentrate on acquiring knowledge related to self-protection, while those who are already infected will need to learn how to care for themselves and take appropriate action. We followed the public health volunteer to the home of another person with HIV in the same village. Just like the other victims, it began with a mere stomachache, prompting them to call the unlicensed doctor and receive injections from him. Their home remains tranquil and shaded as they strive for a normal existence. This presents another major challenge that individuals with the infection face. News of the outbreak in nearly the entire village has resulted in the people of Roka village and neighbouring areas being treated with suspicion and revulsion. This is Chamran, a public health volunteer who provides health education to the villagers. She's also a victim of the infection due to being injected with the same needle. She revealed that out of the 70 members in her family, 21 have tested positive for HIV, and one of them has passed away. She made the decision to become a public health volunteer as she doesn't want others to go through the same traumatic experience. The World Health Organization has reported that Cambodia has an inadequate ratio of doctors to population. In contrast to Thailand's 4 doctors per 10,000 individuals and the United States' 20 per 10,000, Cambodia has 2 doctors per 10,000 citizens. In Roka village, there are unlicensed doctors but also community hospitals. Tuong San Tuong brought his pregnant wife to give birth here.
Từ mà bị thấy nhom mà 4 ngày á mà 4 ngày bị pôn sra con mà nhom mà 8 bị pôn tầm sra con ngày này chôn cá tự tin tham tam 8 tam tiệt chôn cá ọt gran to 8
tập 8 nào vậy
chôn cá bộ con khmai trầm 3 khốp 4 khốp ấy to 8 thòng
thòng hay cho bà bông ấy tên nào vậy màu xong là nào em nào
xong năm ở tiền thế chôn ca tập pon chôn ca mà này chôn ca tam tiền bạn.
Tuong tells us that he would not have visited the hospital if it weren't for his wife's delivery. He typically prefers the services of unlicensed doctors due to their affordability, convenience and friendliness. During our visit to the community nursing home, we encountered only one staff member, an elderly woman named Lo Wan Ni, who claimed to be a nurse. She was the sole healthcare provider stationed at the facility. The infamous case involving Yem Trom's use of a single needle is an explicit example of Cambodia's public health and medical issues. The Khmer Rouge's reign of terror severely disrupted Cambodia's social structure and systems, causing long-term repercussions that are still felt today. Rebuilding the country was an arduous and sluggish process, requiring Cambodia to start from scratch in many areas, including its education and healthcare systems. Consequently, Cambodia's healthcare system is insufficiently equipped to meet the demands of its population, leaving many vulnerable individuals at the mercy of unscrupulous and unlicensed doctors. Tapon is another community that we have had the opportunity to explore. The old shop houses, which resemble grocery stores more than medical clinics, were regularly visited by locals. After requesting permission to enter, we discovered an unclean hospital bed along with numerous used syringes. Initially, the owner of the clinic, who identified himself as a doctor, agreed to provide an interview. Upon noticing our video camera, however, he changed his mind and denied us permission to film within the premises. Despite this setback, he allowed us to follow him to his home. Dr. Wichin's dwelling, in comparison to the general standard of Cambodian housing, could be considered spacious and luxurious. Dr. Wichin claims to have received a scholarship to attend a medical school in Battambang province for 3 years and to possess a valid medical license. Following his education, he was assigned to work at a health centre in a rural village. The clinic we observed was privately owned by Dr. Wichin and operated after official working hours.
cái đăng tam bộ quan ấy về tận á tam quan internet ấy cái mình chơi lên Facebook ấy tới chơi chuan ai chuan đăng trà hỡi dân chơi tận này nam về đầuประชุม ក្រុមប្រឹក្សាភូមិប្រជុំវេទិកាសាធារណៈការងាររដ្ឋហ្នឹងយើងចាប់ផ្ដើមប្រាប់គាត់ពីផលប្រយោជន៍នៃប្រាសេវារដ្ឋនិងវាមានប្រយោជន៍យ៉ាងម៉េចហើយវាជួយយើងឲ្យតាន់ពេលវេលា
Following the government's intervention, Yem Term, the 55-year-old unlicensed doctor who administered injections to the majority of the villagers with a single contaminated needle, was eventually arrested. Yem Term was found guilty of murder, deliberately infecting others with HIV and operating a clinic without a license, and was subsequently sentenced to 25 years in prison by the Battambang Provincial Court. We couldn't find an unlicensed doctor in Roka or Tapon, but that doesn't mean that unlicensed doctors are being wiped out by the government. Around Tonle Sap, which is the largest freshwater lake in Southeast Asia, over 1.2 million people live and work. Since the only means of transportation and communication with the outside world is by boat, we took one to Kampong Priang, a small community situated on the shores of Tonle Sap. Upon our arrival, Sorsad, a local lady, greeted us and informed us of the existence of unlicensed doctors in the area. She called the doctor to her riverside house right away. Within 10 minutes, a man arrived in a boat with a black trash bag and another bag that did not look like a medical bag. The contents of the bag were not typical medical equipment. He proudly displayed a pile of used syringes collected in the black trash bag as evidence of his work. This is an indication of the number of patients who've received injections.
If you want to see more great content from all over the world, please like the video, subscribe to our channel and hit the bell icon. Thank you.
In this village of Kampong Priang, once people heard about the arrival of Mea Suton, a long line of patients formed, young and old, waiting for Mea Suton to give them an injection. We had him examine the rope graze on our ankle. Meas tells us that the wound requires cleaning and the taking of medicine. He had, however, run out of his healing potion. Mea Suton did not hesitate to inject his patient with a sore throat immediately. As for this little boy, Meas inserted a mercury thermometer before administering 2 more injections. We glanced at the number on the thermometer and were shocked to see 36.5 degrees Celsius, which is the normal body temperature. Although the child didn't have a fever, the injection made the mother of the child feel more at ease. From an estimation, the child being carried by its mother had not yet reached the age of 1. It wasn't clear what the diagnosis was, but Meas injected him twice. His injections were carried out under the credulous and hopeful watch of the patient's family. We looked at the label on the bottles. Some are just disinfectants and only vitamin B12 or vitamin C. The Cambodian people we spoke to all expressed a shared belief that when seeking medical treatment, only injections were effective, while pills or tablets prescribed by doctors were not. Mea Suton, who claimed to have acquired some medical skills during the Khmer Rouge regime, admitted that he was not a licensed doctor. During this treatment session, Mea Sultan received periodic phone calls asking him to go and treat patients at other locations. The last patient of this session was the owner of the house. Prior to Mea Sultan's arrival, Saw Sad told us that she has been experiencing a heavy sensation in her body with sore arms and shoulders. She was eager to receive the injection, firmly believing that it would alleviate her symptoms promptly. The locals here place great faith in medical treatments involving injections, as evidenced by the unlicensed doctor's daily use of an average of 100 syringes. Despite the low cost of only $4 per person, the villagers' preference for unlicensed doctors over licensed ones is not solely due to the price. Travelling to see a licensed doctor is inconvenient and often involves long queues with no guarantees of receiving more than just medication. This contradicts their belief that injections, or at the very least saline solution, are necessary for treating diseases, as they don't believe that drugs can cure them. Trust is a crucial factor. After the Khmer Rouge, Cambodia suffered from a severe shortage of doctors and medical supplies. As a result, anyone who could use a syringe was highly respected and even referred to as a doctor. Over time, people grew accustomed to and began to have trust in these unlicensed doctors who were known to the previous generation. Despite the presence of licensed doctors, the locals still prefer to rely on the unlicensed ones. To many Cambodians, the syringe is considered a sacred weapon, capable of curing any illness. With a scarcity of medical and public health personnel, fake doctors have become the trusted option for healthcare, to the point that the people are so reliant on these unlicensed doctors that they refer to them as God doctors.